They retired early and are saving over $17,000 a year in health insurance premiums. Oh, just another great blog post, which I'll put in the doobly-doo, as my man Jonathan Sullivan from Gray Steel says on his YouTube channel. You should check it out. The Barbell Effect, the Barbell Prescription. That's what it is. The Barbell Prescription Plan. Got it back there someplace. Anyway, the doobly-doo. All right, so this is an email I got from a client. Just fantastic, man. I love stuff like this. And we changed the names to protect the guilty and how much they saved. How Donnie and Karen saved $17,575.32 in annual health insurance costs. Hi, Josh. Donnie and Karen from California. Watched yesterday's live stream with J.O., and I had to once again rave about Affordable Care Act, which was the game changer that enabled me to quit my crappy old job at 58. Donnie is 61 and retire early. You and Jay are so right. It's so worth the time to do the research and save thousands of dollars. I'm a spreadsheet fanatic and poured over the Covered California website and any websites and YouTube videos to do my homework before I pulled the trigger. And I told my crappy old job, boom, I'm out. Fortunate to have about 5 years worth of cash on hand. Cash is king. And Donnie's small pension. Must be nice to have a pension, Karen. It's not a big pension. Still must be nice. I modeled many scenarios to determine what income level we should do a test as to get the maximum subsidy and cost share reductions. The sweet spot for us is about $34,000 a year for a silver 87 plan. Sounds like a car, doesn't it? Which results in zero premiums. 087, no premiums, amigos, none. $1,600 deductible for the both of them, and out-of-pocket max of $5,700. That's it. We save $17,500 annually plus our deductible. Out-of-pocket max and doctor copays are lower than our current COBRA plan, but with the same doctors and hospital. Did you hear that, my friends? We save $17,500 annually, plus our deductible, out-of-pocket max, and doctor copays are lower than our current COBRA plan, but with the same docs and hospital. As you can see below, income of $35,000 to $40,000 puts us on a silver 73 plan, which is still quite a high subsidy by a higher deductible and out-of-pocket maximum. So let's see. So here they are. They're in the silver 87. Their income $34,000. Their subsidy is $1,464, 100% subsidy. Out-of-pocket, the deductible is $1,600. Out-of-pocket max is $57. They make $1,000 more. Their out-of-pocket, their deductible is $7,400, and their out-of-pocket max is $12,600. So, if you're at the $34,000, you better do whatever you can not to make any more money. Get rid of those capital gains. Get rid of the whole thing. Well, actually, it's AGI. So, I don't know how California does it, but for AGI, it just is what's on your modified adjusted gross income. And if modified adjusted gross long-term capital gains, if you're in the 12% bracket, they're not subject to income tax at all. So don't worry so much about the capital gains. You still want to look at that, though, double check. But you can see here, you make $34,000, $1,600 deductible, $57 out-of-pocket maximum. You make $35,000, $7,400 deductible, $12,600 out-of-pocket max. Isn't that crazy? All right, as you can see, let's see, $45,000, $60,000 results in a silver 70 plan. For those not spreadsheet savvy or don't want to go through the analysis paralysis, which I happen to love, I definitely suggest they contact Jay for help and advice, 100%. That's fantastic. And so here, if you're making $45,000, you're gonna have a same deductible as if you're making $35,000, but a higher out-of-pocket max. So basically, you're gonna get the subsidies at $100,000 will be 56%. Your copay 44%. You're gonna pay. $639. You're still getting a subsidy of $824. That's not bad. Look at that. The family poverty level, you'll be 574% above that. So, look, man, this is what we've always wanted. I tell you, us right wingers and libertarian types always wanted a voucher program for medical. Screw your employer. What the employer should do is get out of it. Say, we're going to give you money, you go shop. That's what the employer should do. Just say, all right, we're going to, here we're going to give you $10,000 a year. We're not going to pay for it. We're not going to be in charge of administration. We're not going to be in charge of paperwork. We're going to give you $10,000 a year. You go shop. That's what they should do, man. 100%. And yeah, you're gonna have to pay $6,000 a year for premiums. That's $500 a month. What to do? And the company's gonna pay $10,000, $16,000 for you and your family. That's not so bad. I mean, it's not cheap, but that's the way it's got to be. And then think how much they're gonna save the employer as well by not having all the freaking paperwork and all that goes with it. And as such, they can maybe raise some salaries. Anyway, that's good stuff. Thanks for sending that to me, guys, and love to hear your thoughts. See ya.